So I've been making jackets for people with chronic illnesses. It doesn't have to be kids. It can be adults too. And this one I just made for my friend. I make these at my sewing class, and I like lining jackets, so I have this lining in it. I like to write my own songs just to get out like everything that just kind of like builds up inside me throughout the day, and then I just kind of throw it into my songs. And I like to play the guitar, and I have a band. We do original songs that I write.
Ehlers-Danlos syndrome is a collection of connective tissue disorders. For Lucky, it presented with very loose joints, which is common, and joints so loose that they ache, that they dislocate. It's affected her autonomous nervous system, makes it difficult for her to regulate her blood pressure. She started having progressive leg weakness. She had ongoing headaches and migraines. She had back pain. As it got worse, we decided to have it looked into because we had known other children who had Ehlers-Danlos syndrome that also had developed tethered cord syndrome. When we had Lucky first evaluated for tethered cord at a different hospital, they looked at her MRI and said, "There's no tethered cord here."
When I saw Lucky, she came into my office being in a wheelchair. I asked her why, and she mentioned that her legs getting so weak on longer walks that she needs a wheelchair. And she had been using the wheelchair for quite some time, and everything had progressed in the last 6 to 7 months.
I felt tired, and like I had so much fatigue and just sadness, you know.
And so she was just missing out on life, missing out on things that she loved.
People with so-called Ehlers-Danlos syndrome, which is a connective tissue, a collagen disorder, are more prone to develop tethered cord syndrome. The tethered cord stems from embryonic spinal cord that hasn't developed back in its full extent. So what happens is that little piece of embryonic spinal cord at the base of the spine tags and pulls on the spinal cord, and that can cause damage to the spinal cord and progressive symptoms.
Dr. Klinger was the first doctor to say, "I think I can help your daughter."
We know that sometimes the tethered cord can be occult, meaning you cannot see it on the MRI. So we cannot dismiss a problem in a child that is getting progressively worse. We have to listen to the patient, we have to listen to the family, and do a very thorough exam to get to the ground.
Dr. Klinger is like one of the nicest people I've ever met. She's always like, "Hi, Lucky," and then she knows exactly what to do all the time. She's really smart, and she sees what other doctors don't see, and that's really cool.
After we have identified her syndrome and her tethered cord problems, I offered surgical intervention.
The surgery had a profound impact on her quality of life day to day. She stopped using her wheelchair almost completely after the surgery. It was a dramatic difference.
I feel like I'm really strong, like in my legs, and my migraines are pretty much all gone now, and that's crazy. Like, that's super cool that the tethered cord surgery can do that.
We have her in an equine therapy program where through horseback riding, they're able to target certain muscle groups and help patients get stronger.
With horseback riding, it strengthens my legs when I have to like make the horse go and squeeze them, but it also is like really fun, and I get to trot on the horse and get a workout at the same time. So it's not just like doing leg lifts where it's just super boring and hard and annoying.
Great job.
Good boy.
When I saw her a couple of weeks ago for her 1-year follow-up, she looked like a new lady and a new girl. She mentioned that all her leg pain and leg weakness is gone. She has endurance. This is really a great success. How do you say it here? Poster child? That's it.
Dr. Klinger has changed the trajectory of her life, and my gratitude to her is just unending.
Certainly, you know, you deserve all the credit because I know you wanted to become better. but also reassuring for the physician that we have done the right thing for you, that all that matters.
Thank you.
You're very welcome.
I feel like I'm more confident in myself and in life, and that feels really good. Like just walking around makes me feel more confident. That's really cool because that's the tethered cord surgery right there. Like that's what it does. This jacket I made a long time ago, and I just saw this fabric and I thought it was really cool. So this is probably the first like hard jacket I've ever made, and now jackets are kind of my specialty.